We want to begin with the spread of the coronavirus right here in the U.S. Overnight, health officials in Washington, California, and Oregon announcing each state had one person who had contracted coronavirus without knowing how they got it. We have full coverage this morning, including what the president is saying about the coronavirus. But let's begin with NBC's Gadi Schwartz and the breaking news overnight about those new cases. Gadi, good morning. What do we know?
Yeah, good morning, Kristen. These new cases coming as a shock to every single state along the West Coast. California, Oregon, and Washington all seeing instances of community spread coronavirus, meaning officials don't know how these new patients were infected, and 2 of those patients were in close contact with schools.
This morning, the number of cases of the coronavirus growing, the disease spreading. Overnight in Oregon, health officials making an alarming announcement. An elementary school employee has tested positive for the coronavirus.
There was no known travel exposure for this individual, so this is a case of community spread of the disease.
While in Seattle, a high school student testing positive as well.
They are preparing to sanitize the school's campus over the weekend and are intending to remain closed on Monday.
They are the 3rd and 4th cases of what health officials call community spread contagion in the United States, meaning their origins are unknown.
Like the California case reported 2 days ago, our 3rd case did not recently travel overseas or have any known contact with a recent traveler or an infected person.
Now healthcare workers across the country are preparing for a possible pandemic.
This case does signal to us that it's now time to shift how we respond to the novel coronavirus.
In Solano County, California, the nation's first case of community spread coronavirus under increasing scrutiny, the cause yet to be determined. A whistleblower complaint alleging medical staff didn't have proper training or safety equipment when they assisted evacuees who arrived at Travis Air Force Base located in the same county where the patient was infected. Lawmakers demanding answers.
How else did this illness get into the community? Most likely, high probability, it came from the patients, the evacuees that were brought to Travis Air Force Base.
We do not know how she got her infection. I want to be very clear. When one doesn't know, one doesn't speculate.
This while industry giants like Amazon have announced cutbacks on domestic travel for employees, as United, American, and Delta Airlines have all reduced flights to Japan, Singapore, and South Korea. In Japan, schools remain closed for the next month. And while the Olympics are still a go, officials say they're limiting crowds at the torch relay.
Meanwhile, in Washington, school district officials say the high school where that one patient attended will be closed now for 3 days of thorough disinfecting, and those who came into contact with that patient will now also stay home and away from others and be monitored for symptoms for 14 days before being cleared to return back to class. Kristen?
The community and the country watching those cases closely. Gadi, thank you for that.
President Trump downplayed coronavirus fears on Friday night as he spoke to supporters at a rally in South Carolina. The president claiming Democrats are politicizing coronavirus and calling it, quote, their new hoax. In just a moment, we will talk to the doctor, Anthony Fauci, who is the director of the government agency leading the charge against the virus. But first, we turn to NBC's Hans Nichols, who's at the White House this morning. Hans, good morning.
Good morning, Peter. Late last night, the president accusing Democrats of trying to politicize coronavirus. He's suggesting that the press and Democrats are exaggerating the threat and calling their response to the crisis their new hoax.
At a raucous South Carolina rally, President Donald Trump casting doubt on the coronavirus outbreak in this country and casting blame on the Democrats.
This is their new hoax. We have lost nobody to coronavirus in the United States. The press is in hysteria mode.
The president's comments echoing his chief of staff earlier in the day, claiming that criticism and coverage of the government's coronavirus response were politically motivated.
They think this is going to be what brings down the president.
The president using this crisis to claim that border security is health security.
Whether it's the virus that we're talking about or many other public health threats, the Democrat policy of open borders is a direct threat to the health and well-being of all Americans.
After suggesting at the White House that he may expand his coronavirus travel ban to more countries, including Italy.
We're looking at a couple of countries, a few countries that have a little bit disproportionately high number, and we're going to make that decision very soon.
As the U.S. called off a major summit of Asian leaders in Las Vegas next month, the president also accusing Democrats and the press for overinflating the risks from the virus. The president's rally coming after yet another brutal day on Wall Street amid growing uncertainty over the coronavirus, with the stock market having its worst week since 2008 during the height of the financial crisis, dropping nearly 12%. Leading the Federal Reserve to issue a rare statement that it was prepared to use its tools and act as appropriate to support the economy, and the president urging them to act.
I hope the Fed gets involved. I'm not a big fan of the Fed. You know that. I think they make a lot of mistakes. They've made a lot of mistakes, but I hope the Fed gets involved.
The president is also considering a tax break to stimulate the economy and using a little-known Korean War-era act, the Defense Protection Act, to try to ramp up production of certain gear, equipment in the event of an outbreak. Peter, Kristen.
All right, Hans Nichols at the White House. Hans, thank you.
Let's bring in now Dr. Anthony Fauci. He's the director of the Infectious Disease Department at the National Institutes of Health, and he's part of the White House team leading the battle against coronavirus. Dr. Fauci, good morning. Thank you so much for joining us. We are going to get to the government's response, but first, I want to get your reaction to what we heard from President Trump overnight at that political rally. He referred to fears about the spread of the coronavirus as the Democrats' new hoax. Is this a hoax?
No, I mean, I can't comment on what you just asked. I'm just going to comment on what is going on. And what you just showed is that we're having now the beginnings of what's called community spread. And that's one of the things that one needs to be concerned about, because when you have community spread, it becomes more difficult to track down what the original source was. Because countries other than China now are having so many cases like Italy, South Korea, Iran, we will then start seeing individuals in this country with community spread. In other words, no specific attachment to or connection to a known case. So that makes the tracing much more difficult.
Yeah, so you say it makes it more difficult, Dr. Fauci. Help us better understand that. How does that change our ability to combat this, to keep it from spreading further within the United States?
Well, let's take, for example, when people came in from China, and they were immediately identified because we knew who they were beforehand. What you do is you identify, you isolate, and you contact trace, because you know what the index case is. When you have a community spread, someone appears, had to have been infected by someone, but you don't know who that person was. So then you have to backtrack and do all of the contact tracing to do the isolation and to get them under an isolation a protocol. That's much more difficult when someone just appears in the community and you don't know what the source of that infection was.
Dr. Fauci, there have been serious questions about the reliability of these tests nationwide. Does every single state have the ability to accurately test for and identify new cases of coronavirus?
You know, it isn't a question of the accuracy of the test. Right now, and there has been some delay there, there's the question of the availability of the tests. And that was something that was a problem that is now being rapidly fixed by the CDC as we're getting many, many more tests out there so that the health departments and even individual hospitals can be able to test much more easily, with the results getting back much more quickly.
So, Dr. Fauci, it's Saturday morning in America. People are waking up right now with real concerns about this. They want to go to malls and movies, maybe the gym as well. Should we be changing our habits, and if so, how?
No, right now, at this moment, there is no need to change anything that you're doing on a day-by-day basis. Right now, the risk is still low, but this could change. I've said that many times, even on this program. You've got to watch out, because although the risk is low now, you don't need to change anything you're doing. When you start to see community spread, this could change and force you to become much more attentive to doing things that would protect you from spread.
Dr. Fauci, quickly, how does this all end?
You know, it ends it depends on the nature of the outbreak. I mean, this could be a major outbreak. I hope not. Or it could be something that's reasonably well controlled. At the end of the day, this will ultimately go down. Hopefully, we can protect the American public from any serious degree of morbidity and mortality. That's the reason why we've got to do the things that we have in our plan.
Dr. Fauci, thank you so much for joining us this morning. We really appreciate it.
Good to be with you.